I am Dr. Geoffrey Gibney, medical oncologist at MedStar Georgetown University Hospital. I also lead the melanoma and cell therapy programs for solid tumors. I see a range of patients with advanced skin cancer. Some have been surgically excised and high risk for recurrence. Others have recurrent disease and require systemic therapy. My philosophy of care is really to understand the whole person, to understand their course of what they've gone through, their social situation, their other medical problems, and to set expectations of what we're going to go through with the treatment that is planned. The future of cancer care in many tumor types is evolving very quickly. We've now had development of multiple immunotherapy strategies, which is different than the standard chemotherapy. In melanoma in particular, we've had some great successes with the anti-PD-1 drugs and anti-CTLA-4, but we know that not every patient will respond to those therapies. So there's been major research developments trying to expand the types of treatments, the number of patients that can be treated, and we've now had a recent approval for a new T-cell based therapy. We think patients should come to MedStar Georgetown University Hospital because of our excellence in taking care of patients here. We have a team approach ranging from social workers to nurses to medical oncologists. We have a wealth of experience giving novel immunotherapy drugs as well as standard chemotherapy drugs. We've been doing this on research trials as well as standard of care, and we continue to thrive and expand what we can offer patients. The most rewarding part, I would say, of my work is to meet people for the first time, understanding what they've been going through, and really going through what we can achieve with our current therapies. Some patients don't realize the major advances that we've had, where we see durable responses, patients can be put in remission, and the therapies can be very well tolerated in many cases. So it's potentially a very exciting time where a patient comes in very nervous and anxious and leaves with a lot of hope. So T cells are a type of white blood cell that's derived from a patient. And the T cells are collected and in some cases manipulated in the laboratory, other times just expanded and grown, and then they're reinfused back into the patient as a therapy. There's been an FDA approval for a new form of T cell therapy called CAR T cell therapy in some of the hematologic malignancies, such as lymphoma, leukemia, and myeloma. This is now expanding into other tumor types. We have a recent FDA approval, accelerated approval for T-cell therapy in melanoma. There are some subtle differences between these types of therapies, but the idea is that we use a patient's own T cells to attack the cancer and hopefully eliminate it. T cells are collected and in some cases manipulated in laboratory, other cases just expanded and grown. Those T cells are reinfused back into the patient as the therapy, and those T cells attack the cancer with the hope to clear it. T-cell immunotherapy for melanoma is a breakthrough therapy because it has responses in up to a third of patients where other therapies have failed. This type of therapy also has the potential to put patients in deep responses, remissions, and we've seen in historical data where these patients can maintain those responses for years to come and potentially permanent. T-cell immunotherapy is approved for melanoma in the setting where patients have metastatic disease and they've been previously treated with an anti-PD-1 immunotherapy agent, as well as a BRAF or MEK inhibitor if their tumor harbors a BRAF mutation. Those patients would be potentially eligible in that setting. Now, beyond that, there are certain criteria that we also look at for patients that would be good candidates for the therapy. This therapy is associated with certain toxicities, so we do look for individuals that have good functional status and have good cardiac and pulmonary status. Patients also are required to have a tumor that can be excised for production of their T-cell therapy. So when we meet the patient, we try to go through and understand what their course has been, where their needs are, what their goals are. Some patients have other medical issues that need to be addressed at the same time. Ultimately, we're trying to improve outcomes for patients. Our therapies are very effective, so we're trying to improve survival, put patients in remission, and where they hopefully will go back to their normal lives. As a patient going through the process of receiving the T-cell immunotherapy, there are a number of steps that you need to be aware of. The first step is identifying a patient who's appropriate for the therapy and we think has the ability to go through the steps of the treatment. The treatment is associated with side effects, and there also is time required for preparing the treatment. The first step is to identify a tumor that would be removed for the therapy to be produced. Typically, we look for a superficial tumor, something just under the skin, or a lymph node would be an ideal tumor site. That is removed with a minimal surgical procedure and sent off to a manufacturing facility. At that facility, the T cells from the patient are extracted from the tumor and grown from thousands to billions. That becomes the T cell product that is then reinfused in the patient. When patients have their T cells grown to that amount, which takes about a month course, they are brought back to the hospital to receive first chemotherapy, followed by their T cell infusion, followed by a course of interleukin-2. That is administered in the hospital under supervised conditions because there are a number of side effects that can happen during the treatment course. Once patients recover, they're discharged from the hospital and followed in the outpatient setting. This therapy can improve a patient's quality of life once they've gone through the therapy. We have to recognize that there are side effects that happen during the course of treatment. So in the first few weeks during the treatment, the patient has to tolerate certain side effects to get through the course. But once the patient has finished the treatment, which typically is about a 2 to 3 week window, they recover and hopefully will respond to treatment. In those patients that respond to treatment, we expect their quality of life to be greatly improved. Currently, Amtagvi is not FDA approved for tumor types other than melanoma. So currently we're not able to offer this type of therapy for other tumor types. However, clinical research has shown that this type of T-cell therapy can be effective in tumor types beyond melanoma, and we hope in the future we will have the ability to treat patients. At MedStar Georgetown University Hospital, we have T-cell immunotherapy trials for melanoma, hematologic malignancies, as well as other solid tumor types. At MedStar Georgetown University Hospital, we have a team approach for the treatment of patients with T-cell immunotherapy. This includes a new patient nurse coordinator that helps coordinate the first consultation with the patient and gathering all the information. We have nurses that help with the coordination of the steps beyond that for the surgical consultation, the surgical operating date, the shipment of the tumor for development of the product, and coordination of the hospitalization where the patient will receive the treatment. This therapy, while it has side effects during the treatment course, if a patient responds, ultimately changes the course of their life and clearly the quality of life they would have. In the United States currently, there's an estimated 8,000 patients that still die from melanoma every year. And those patients are looking for new therapy options. This therapy, Amtagvi, has a response rate in about a third of patients, meaning a third of patients can potentially respond and have a durable, meaningful response that changes the course of their life. Patients should choose MedStar Georgetown University Hospital for their care because of our team approach, the expertise we have in treating patients with cancer, and the involvement in the developments in clinical research that we participate in and offer our patients as part of the course in treating their cancer.